Now, for men suffering from ED, a treatment called acoustic wave therapy is the solution that they've been looking for, all without pills, needles, or surgery. And patient care advisor Bill Jeffries is here with all the details. As always, Bill, always great to have you.
Thanks, Alex. Good to be here.
Nice to see you. So we're talking about, like I said, acoustic wave therapy, and you're calling it a breakthrough therapy. Why is that, and what is it all about?
Well, about 20 years ago, when the oral ED medications came on the market, it was a groundbreaking change for guys who suffer from ED, because before that there was nothing. Right. And the problem with the oral medication is only about half of the population that needs the help can stand the side effects, or they have other drug interactions that just make the oral medications not appropriate for them. With acoustic wave therapy, it's safe for just about everybody, and it's just a game changer, and we can heal the body naturally without the need, as you said, for drugs, pills, or surgeries. So it is a breakthrough.
Right, and it's not invasive, right? I mean, a lot of people might expect these types of treatments to be, but it really isn't. So let's dive into how it actually works, because acoustic waves, people might think, well, that sounds pretty sciencey.
Yes, it does sound pretty sciencey, but if you think about the same technology that they use to break up kidney stones, it's a relative of ultrasound, but those acoustic waves are used. In this case, we use a different frequency and a different intensity than they use for kidney stones. But what we do is we break up the plaque and the blockages that just naturally form in our arteries and veins as we age, and get rid of those blockages and return proper blood flow.
Well, and if you watch TV even for 5 minutes, chances are you're going to hear about ED, and we're hearing a lot more about it. Is it because guys are more willing to talk about it, or what's the reason that it's surfaced so much as a topic?
I think that's part of it. It's having more discussion about it, having more advertising. It kind of destigmatizes it for guys, and it's just kind of come out into the open more that people feel comfortable talking about it. They realize it's just something that happens as we age.
How common is it?
Statistically, it would seem that about half of all guys, by the time they're in their 50s, have some ED issues, and it kind of goes up in with the decade. 60% of guys in their 60s, 70% in their 70s, and so on. So that seems to be the normal track.
And going back to the treatment, what about guys with other types of medical conditions, like, say, heart disease or diabetes? Does this interact negatively with that?
Not at all. We, of course, have every patient, when they first come in, meet with our staff physician, and he'll review the health history and other medical conditions that a guy is dealing with. But speaking about diabetes, a large percentage of our patients are diabetic, and as you know, diabetes, one of its side effects is poor blood flow. It constricts blood vessels, so it's working against. So if the diabetes isn't the cause of the ED, it's certainly a contributing factor.
And as common as it is to hear about it, some guys may still feel a little bit weird talking about it, right? So what do you do there at Flagstone to make them feel comfortable with the process, with the topic, and the help you're going to give them? Sure.
When a prospective patient calls, one of the things they'll notice, or when they visit the clinic, we have an all-male staff. We have a single focus. All we do is treat ED. We talk about it all day, every day. We're well versed. We're experts. The medical people on our staff have years and years of experience with this condition, and we just work really hard to make a patient or a significant other, if they're the ones that make that initial call, just feel comfortable to talk about it.
Well, and it's those significant others that are also affected, right? It's not just a guy's issue, it's a couple's issue.
It is.
So how should couples, and we've talked about this before, but what should they do to initiate that conversation? It's just putting it out there in the open, right? It's the elephant in the room in a lot of relationships.
Yes, it really is the elephant in the room. And, my advice is just do the research. Our website has a whole lot of information about ED causes and cures for it. there's medical studies, and it's a medical condition, just like diabetes or heart disease or broken arm. They're all medical conditions, but this is a medical condition that we can fix.
Well, and it's a medical condition that obviously manifests itself as physical, right? But the emotional aspect of it is also there in a big way, not only personally for the guy, but of course for the relationship. It can be a pressure that they're feeling that they may not totally understand, that if you take care of it, you can all of a sudden relieve this big issue that you may be having. And so looking into it takes no effort, and obviously getting treated has no real side effects, no real issues. It's just going to make you happy. So,
other than a better relationship.
That's a good side effect, I'd say. Bill Jeffries, thank you.
Thanks very much, Alex.
And right now there's a special offer. You can get a free initial consultation if you mention the Morning Blend. That's a $199 value. And if you want more information, visit flagstonemedical.com or call 520-600-4405.